The pandemic has taken a heavy toll on mental health, even in kids as young as 5. Our expert, Bill Prasad, has new numbers from the CDC in today's Mental Health Minute.
The number of children and adolescents suffering from mental health disorders cited in a Centers for Disease Control report may be a gross underestimation. Earlier this week, the CDC said there had been a 24% increase in mental health visits to emergency departments by 5 to 11-year-olds when they compared March to October of this year to the same period last year. The numbers are worse for adolescents aged 12 to 17. With this group, there was an increase of 31%. COVID-19 has stolen birthdays, prom, graduation, and athletic events from many of these kids. These rites of passage have been wiped away like a wave, erasing footprints in the sand. This, along with worries about the safety of their family members and friends, and what was an unknown ending point, have led to high levels of fear, anxiety, and depression among many youngsters. But the numbers do not tell the entire story. Many kids seeking help are admitted to psychiatric hospitals or treated by private practice clinicians. They were not counted in the CDC research. What can a parent do? Tomorrow, I will talk about what moms and dads might see in a struggling child or teen and what actions they can take. Parenting is the toughest job in the world. It would be my pleasure to help. I'm Bill Prasad, your mental health and wellness expert.